going to look at the cervical spine and look at active range of motion. So we look at quality, quantity, and reproduction of symptoms. So as always, we always establish resting symptoms before we have the patient move in the direction that we want them to move in. So do you have any symptoms right now? No. So I'm going to ask the patient, I want you to bring your chin all the way down to your chest. Any increase or decrease in symptoms? No. So I'm looking at quality and quantity of movement, and I'm looking to see also if they deviate in any direction. Just because patients will do that, they'll try and avoid the pain. If they do so, I'll say, okay, and then I'll direct them in the direction that I want them to go in and see if that changes their symptoms. So once they've done their active range, I'll have them ask them any resting symptoms. If not, chin down to your chest. Going to overpress to clear flexion. Going to hold around their CT junction with one hand. Going to bring the other hand in the occiput, and it's going to be a kind of a bowing motion and a little overpressure. And then bring their head back up. Any increase or decrease in symptoms as I do that. Doing okay? Mm-hmm. Now we're going to look at cervical extension. Establish resting symptoms. Let me have you look up into the ceiling. So here I'm looking at quality and quantity of movement, and then come on back up. And if they have any deviation, again, changing that to the direction that I want them to go in. Let me have you look up again into the sky. So here I'm going to bring my right hand into their forehead, bring my other hand into the chin, and here I'm going to take them into extension, feeling for end range, and feeling and asking them again any increase, decrease, any change in their symptoms. So that's cervical extension. Now I'm going to look at cervical rotation, again establishing resting symptoms. Let me have you turn to the right and come on back up. Any increase or decrease in your symptoms? Nope. And then have turn to the left. Any increase or decrease in their symptoms, looking at quality and quantity, and if they deviate in any direction to make it more of a rotation, then I'll guide them to where I want them to see and see if that influences their symptoms. If it doesn't, then I'm going to overpress to check rotation. So let me have you turn to the right. No symptoms. So I'm going to come and face them. I'm going to put one hand in their along their thoracic spine, the other hand around their zygomatic arch, elbows out, and I'm going to take them into rotation to their end range, feeling for overpressure. Any increase in symptoms?
No.
Okay. So we want to make sure that we have good stability here with rotation, because if I don't have my hand there, then I could take them into side bending, or they could rotate within their thoracic spine. So I'm really trying to clear that rotation if I haven't reproduced it just with their active range. And then the same thing to the left. Any increase, decrease, change? Nope. Have them go again. I'm going to come to their side, stabilize their thoracic, come to their zygomatic arch, and applying overpressure and doing little 2-3 oscillations, feeling for any reproduction of symptoms. So with my overpressure, I'm not just applying overpressure to see if I can reproduce or increase their symptoms, but I'm also feeling for quality. And the quality of movement, does it feel hard? Does it feel soft? Is there a little spasm? So I'm looking for all that with my overpressure also. Now with side bending, I'm going to have them side bend to the right. Jason's already doing it, which is great, but usually I have to direct my patients. I want you to bring your right ear to your right shoulder. And here I'm looking for quality and quantity. And Jason doesn't look quite, looks a little stiff over there. Quality, not quite as good as we'd want, but then, so I'll have them side bend again. Any increase in symptoms? If not, what I can do here is do a little bit of differentiation, is applying upper, mid, and then lower. I can't really quite because I think his upper cervical spine is really stiff. But where you can do kind of a karate chop on the upper, mid, and lower to see if you can, and fulcrum over that area and to differentiate and see if you can reproduce their pain. And they may lead you, is it more upper, mid, or lower cervical in terms of reproducing their symptoms. And the same thing here. So I'll have them side bend, bringing your left ear to your left shoulder, and then come back up. any increase or decrease in symptoms. And then once again, left ear to left shoulder, and I'll come in, and I'll do a little bit of differentiation, mid-cervical, and then lower, and applying overpress. Having done all cervical flexion, extension, rotation, and side flexion, if we still haven't reproduced the patient's symptoms, one more aggressive maneuver to really clear out the cervical spine is to doing a lower cervical quadrant. So here we're going to test both sides. So here what I'll have the patient do is say, look towards your right and upper corner of the ceiling and seeing if that increases their symptoms. If not, then I'll guide them to that position again, come over, stabilize here in their scapular area, elbow out, and then applying overpressure, and then increasing and seeing if that increases or decreases their symptoms. Again, let me have you look over to your left corner. Any change in your symptoms? Nope. Then I'll guide them into that position and elbow out and applying overpressure, feeling for quality of movement, quantity of movement there, and any increase in symptoms. So that completes the mid to lower cervical active range of motion examination. Now we're going to look at the upper cervical spine. So any patients that may come in with upper cervical symptoms or headache symptoms, you definitely want to look at their upper cervical spine. Again, establishing resting symptoms. Then what I'm going to have the patient do here is what I want you to do is stick your chin out forward for me and then come on back up. Any increase or decrease in symptoms, let me have you do that again. So I'm going to hold here, get hold of their head. My hand's going to be in their chin, and it's going to be kind of a bit of a scooping movement where it's just a little movement and any increase or decrease in symptoms with that. Now I'm going to have you tuck your chin in. Any increase or decrease in their symptoms? If not, come back and let me have you do that again. And here I'm going to have one hand in their chin, other hand in the occiput, and I'm going to add a bit of overpressure. Feeling for quality, quantity of movement, and reproduction of symptoms. Then we could have looked at side bending, which we did earlier with the cervical side bending. But just to review, what we'll do is the good old karate chop, more in the upper cervical spine, hand over the zygomatic and doing overpressure, side flexion to the left, and then same thing, side flexion to the right. Let's say that wasn't enough to reproduce their upper cervical symptoms. Now we're going to do what's called upper cervical quadrant. It's a combined movement where we're going to add upper cervical extension, side bending, and rotation. So to emphasize the right side of the upper cervical spine, here I'm going to first have the patient just go ahead and bring their chin out. But then I'm going to guide the position. So here we have upper cervical extension. So I'm going to maintain that position. Then I'm going to do upper cervical rotation. And then upper cervical side bending. And hold in there. So it's a combined movement. And then coming out and see if that reproduces the patient's symptoms. So once again, it's having the patient stick their chin out, extension, going to do rotation, and then side bending. And this is a very difficult maneuver because you have to hold on to each component. If one component is lost, if I don't hold on to his extension and I add rotation and then I side bend and I'm out here, I've passed his upper cervical spine. So it is a difficult maneuver to perform. To show it on the other side, go ahead and protrude your chin out. Going to hold here. Going to add a little overpress. Then going to rotate. And then going to side bend. And there, an end range. And then give them a little traction because it's a little aggressive maneuver in the upper cervical spine. And that concludes cervical active range of motion.